this is one of the most notable shifts I've seen, and that's the number of faculty and staff colleagues around the university thirsting for training. They're coming to us looking for support and guidance given the changing needs of our students.
The world's biggest problems aren't waiting, and neither are the people solving them. Hi, I'm Kara Baskin, and welcome to our podcast, From Problems to Possibilities, Entrepreneurial Leadership in Action, presented by Babson College. Are you like me? Do you see a problem that feels impossible to solve? Don't despair. In this podcast, there's hope. We'll pose a problem, enlist visionaries within the Babson community and beyond, and explore possible solutions. There's a lot we're going to learn right now as we go from problems to possibilities. Are you a college student or close to one? Then you know the pressures, confusion, and mental health challenges students face. These challenges also face college campuses. Today, campuses reflect the nation's debates, tensions, and polarization. That's why we're tackling one of the most urgent questions in higher education. How can colleges and universities truly support student health and wellness? And just as importantly, how can entrepreneurial leadership help reimagine what support looks like?
Hi, I'm Dr. Ryan Travia, Associate Vice President for Student Success at Babson College.
And I'm Dr. Thad Mantaro, Dean of Student Health and Wellness at Dallas College.
Ryan and Thad are national voices in campus well-being. They work at very different colleges, Babson and Dallas, serving students from very different socio-economic backgrounds. But they share a passion for building strong well-being programs. That shared passion led to their book, Well-Being Leadership in Higher Education, a practical roadmap for rethinking how higher ed approaches wellness. Ryan, Thad, thanks for being on the podcast.
Thanks for having us, Kara.
Thanks, Kara.
Ryan, in one of your roles at Babson College, you serve as a senior on-call dean responding to student and campus crises. What problems are you seeing the most of?
We might respond in one of the student residence halls if students are having trouble managing conflict with their roommates and it's sort of exceeded the capacity of the RA or the resident assistant or even first-line professional staff. Certainly if there is a drug or alcohol overdose with some co-occurring trauma or some other medical complexity, we would be brought in for any significant mental health concern, particularly students who are either expressing suicidal ideation or those that in some cases have made an attempt.
Would a student call you and say, hey, I'm feeling really depressed right now, I need some help? Or would that come from perhaps a professor who's saying, hey, I noticed the student might not be showing up to class as much? How are you actually getting involved?
We're incredibly fortunate to have a fully accredited campus police department. Typically, a call will come through the dispatch, and then they will work with the caller, whether it's a faculty member who might be calling about concerns for one of their students or a parent who hasn't heard from their child and is asking for us to conduct a well-being check, or students themselves, which I think is another unique dimension of our current generation of students who are okay with not being okay and are also comfortable saying those words out loud.
What are some outdated assumptions in higher ed about student wellness, and how do we need to frame it differently for this generation of student? Thad?
Previously, it would have been the purview of the counseling center, that the counseling center was intended to be the sole proprietor of mental health services on campus. And now we see services, number one, as more integrative and the responsibility of the entire campus community. But we also think about it from a stepped care model where we maybe have a certain kind of scope of practice for some students on campus who present with adjustment disorders or certain levels of depression, anxiety, relationship issues. If they need a lower level of care, maybe we refer them to some kind of program or outreach or psychoeducational workshop. If they need more intensive care, at least in our setting, we partner with a community-based nonprofit that can assist us with more intensive concerns. We don't have providers on staff the way that some schools do. We don't have a psychiatrist, for example. So through that relationship with that provider, they can receive medication management, intensive outpatient, more extensive level of services that we simply don't provide.
Young adults who perhaps were in high school during COVID, there's more and more loneliness, there's more and more isolation. Ryan, what's the entrepreneurial approach for this new generation? And what's Babson doing?
I think now more than ever, and this is consistent with our ET&A, entrepreneurial thought and action methodology here, is empathy at the core. And I think that's so important, particularly in a post-pandemic world where so many of our young people unfortunately missed some really significant developmental milestones. These are perfectly well-developed, really bright, high-achieving young adults who might also be struggling still in some dimension around social emotional well-being. I want students to talk with whomever they're comfortable talking with, a coach, an academic advisor, a faculty member, a trained student leader.
Hi, I'm Alex.
I'm Herman.
What would you tell another first-gen student who feels lost right now?
I would say just find your people. I know it's hard being in another state, maybe in another country, being far from family, being far from your peers. Yes, I miss my family, but I have found my people here and I'm very grateful for them.
We don't expect these folks to serve as clinicians, but we do expect these folks to lend an empathic ear and to make what we call a warm handoff or a referral to an appropriate resource.
Taking 10 seconds to ask a favor. Share this podcast with your friends and colleagues and click follow so you never miss an episode. Now back to our conversation. Ryan, you used the word empathy. How do you actually implement that?
This is one of the most notable shifts I've seen, and that's the number of faculty and staff colleagues around the university thirsting for training. They're coming to us looking for support and guidance given the changing needs of our students. There is truly a collaborative spirit here, and folks tend to be really invested in one another's success.
Ed, how do you address loneliness and how do you foster connectivity in a very different environment?
I don't think we approach it as directly as we're talking about. I think instead we tend to really think about our populations, first time in college, low SES or low socioeconomic status, and try to address those students through a variety of basic needs. Some of them are struggling with homelessness, some of them have food insecurity, some of them are parenting. So trying to address loneliness and belongingness, sometimes we come at that through trying to address their basic needs through an integrative unit on campus, the Student Care Network.
What does that look like in practice?
We have a centralized hub with student care coordinators who receive referrals for students who have needs. And then around that hub, we have basic needs coordinators, we have the counselors, we have our nurses and health promotion coordinators, and all of them in a collaborative way try to address needs of students.
I'm wondering, Ryan, because you do focus so strongly on data in your book, what other types of data should colleges be collecting that could foretell anxiety, depression, predisposition to mental health challenges down the road?
Certainly there are institutions that continue to employ campus health surveys just to get a lay of the land. Generally, most institutions would implement something like that every 2 to 3 years. What are the rates? What are we looking at? Where do we need to focus our efforts?
Bad?
We collect survey data that helps us assess whether or not our counseling processes are having an impact on the student in their interaction with the counselor. And additionally, almost all counseling centers are using electronic health resources to assess and understand what's happening. Are students coming for anxiety, depression? What are they presenting with? And so all of that data is really typical for us to have.
We want to know your opinion on this topic. Send your comments to podcast@babson.edu. Now back to our conversation. I wonder that for the population at your school, where you are perhaps dealing with students who have such acute needs, might they almost feel desensitized to mental health struggles?
Not only is stigma huge because of our population, we're something like 86% students of color. Folks also felt like not only did they want to talk to a friend or a parent or someone first, they didn't deserve, there was this deservingness, like somebody else had problems that are worse than mine. I don't want to engage in those services. I'll be taking something away from somebody else.
Ryan, how do you make sure that you're not overly siloed in this traditional campus environment where there are so many different folks involved? How do you actually foster cohesion?
I think the best example of how that manifests, certainly here at Babson, are through our care network, or what many would refer to as a care team. These are multidisciplinary committees and groups of professionals on campuses that gather to review reports or referrals of students of concern. Everything from traditional adjustment or transition issues to students who maybe have not been showing up for class, all the way to students who experience their first psychotic break or make a suicide attempt, etc. These care teams really started to proliferate across the nation in the aftermath of the Virginia Tech massacre in 2007.
Witnesses describe scenes of mass confusion and unspeakable horror as a troubled student went from room to room in Norris Hall, shooting students and faculty indiscriminately. By the time it was all over, 33 people were dead.
In the postmortem, they were able to find all these breadcrumbs of information that lots of folks on campus had, but there was no cohesion. There was no system or structure in place to allow folks to communicate and really think about earlier detection, earlier intervention before it gets to that obviously very extreme place. We'll do a random well-being check if we have to, but I'd rather not deploy some administrator or dean to go do a door knock for a student or pull them out of class. I'd much prefer to lean on the coach or an advisor or someone else who knows the student.
I'm dating myself, but I think back to when I was applying to and going to college, it was like, oh, this is a pressure cooker. And that meant that you were going to a great school. And sometimes it's almost like a pain contest. Who stayed up later? Who's working harder? Thad, how do you disentangle those two things and make sure that students are thriving academically? And if you want to get good grades, great. But how do you make sure that you're also prioritizing mental health when often those two things can seem at odds?
Students come to our institution fairly transactionally. They are working 2 other jobs. They have family. They're providing for their family. So the pressure cooker is their life outside of school. They're trying to complete a 2-year degree or a credential, and then they're coping with everything else that's going on in their life, and that's complicated for them often. And so the messaging we provide is how to manage those other facets of their life and integrate their work, their school, their family life all into one kind of gestalt, and to do that in a way that allows them to seek some balance.
Babson College recently launched a campus food pantry that offers free food and personal care items to students who might need it. I think that's a perfect example of entrepreneurial approaches to reaching students.
You know, at Dallas College, one of the things that we find is that even something as simple as a vaccination, meningitis vaccination, is a barrier to enrolling. And so we have offered hundreds of thousands of dollars worth of vaccinations to students so that they can complete their application.
Bottom line, how can entrepreneurial leadership help colleges and universities reimagine student health and well-being? And I'd like each of you to answer that in your own way. Thad, let's start with you.
In different contexts, there's going to be different meanings for what it means to have a well-being program. Certainly at a small private 4-year liberal arts institution, you're going to have a lot of emphasis on substances, prevention of interpersonal violence. But for us, that might be radically different. The kinds of ways that we're responding interdepartmentally is very different. So repositioning, a paradigm shift for well-being being seen as something that we create collectively and that we respond to collaboratively.
Ryan?
It's all about taking calculated risks, leaning into a global perspective, and understanding that, as cliche as it sounds, it does take a village. We need to move beyond these traditional medical models where it's individual ailments that require treatment. We need to focus far more on prevention and reframing well-being leadership as public health leadership and looking at the various systems and settings at play within the unique dimension of our own communities, and what's going to work well for one institution might look wholly different for another institution.
Thank you both so much for sharing something that is really close to my heart. I really appreciate it.
Thank you, Kara.
Thank you, Kara. Really enjoyed the conversation.
The conversation doesn't end here. Share your comments at podcast@babson.edu. You never know, we may use it in an upcoming episode. Plus, you can help grow the podcast. Share it with your friends and colleagues, click follow so you'll never miss an episode, and leave a 5-star rating and review, which tells the algorithms that we're doing something special here. Thanks for listening to From Problems to Possibilities, Entrepreneurial Leadership in Action, presented by Babson College. I'm Kara Baskin. See you next time.